Hey guys, welcome to today's Facebook Live video. Today, Gavin and myself are going to talk about what's known as wry neck. Now, wry neck is basically, essentially, it's a morning neck pain and stiffness. So you wake up in the morning and you can't move your head properly. Quite a common condition. Most of you probably experienced it at least once in your lifetimes. So we're going to talk about what actually causes it and how to get rid of it when you have it. So first of all, so wry neck. Who gets it? So there's basically two main types. Okay, so there's a facet joint wry neck and what we call discogenic wry neck. So a wry neck caused by a disc problem in your neck area. Okay, so the facet joint wry neck happens in people, in really young people, so under the age of 30. Okay, so usually people in either teenagers or more common in their 20s. So basically, what happens with facet joint problem is that you either wake up in the morning and you really can't move your neck properly, or you do a sudden movement, either playing sport or doing something else, and your neck just locks up in that position, and you can't move your head the other way. So you can move it one way, but not the other way. Discogenic wry neck is usually happens in older people, so we're talking usually people over the age of 40. The cause of that is usually not the sudden movement, but just again waking up in the morning and feeling really stiff and sore. Usually it involves sleeping in awkward positions, so that's why we always discourage people from sleeping on the stomach, and you must make sure that your pillow is correct for you. Everyone has we're all different body shapes and sizes, so you have to pick the right pillow for your body type and size. Okay. So what happens with a facet joint wry neck? Basically, one of your facet joints in your spine, in the neck, just locks up. It it just gets stuck in one position. Okay, so then it basically needs a few days to get unstuck. Okay, so as opposed to a disc problem, a disc usually deforms. So we're talking about this discogenic wry neck in people over 40. So disc usually either protrudes backwards or it bulges out. So it starts to get in the way of little nerves and ligaments at the back of the neck. So it starts to cause a bit of inflammation and pain. So that's the difference between the two. Symptoms. So what do you actually feel when you get when you get a wry neck? So with the facet joint one, you tend to get one-sided pain. So usually pain is very much kind of in the middle of the neck, and it's on one side, either left or right. And it will feel like a blockage. So you can turn your head one way, but the other way just wouldn't go, so you can't either turn or side bend it. Okay, so that's a very sort of obvious feature of facet joint wry neck. Discogenic wry neck, kind of similar. So again, pain is usually one-sided, but it tends to go a bit lower. So it's either the lower part of the neck or even like kind of in the shoulder blade area or in the upper back. Okay. Again, blockage, but this blockage of movement is a little bit more limited by pain, so you can actually physically go the opposite way, but it's just too painful to do. And quite often with discogenic wry neck, because the nerves are involved, you get referring pain into your arm. So you get radiating pain, can go down to the elbow, sometimes even goes to your hand as well. So that if you get those symptoms, you probably have a discogenic wry neck. Treatment with the facet joints, so again, younger people, if they go and see a physio, which you probably should if you have one of those, what we tend to do is we mobilize the joints, so we apply a bit of pressure on the joints to get them moving, to free them up. We do a bit of massage to relieve muscle tension and muscle spasm. We teach you how to kind of keep yourself in the right position. It's very important to maintain the right posture. We'll give you some stretches. Important with the wry neck is that you keep moving. Now, nothing extreme, so you're preferably not lifting any weight or playing any contact sport, but just walking around is really good. So keep moving. And if it's quite bad, maybe you need to go and see a doctor and get some pain medication, just so that you can actually maintain an activity level. So the more you move, the better it gets. But sometimes to be able to move, you actually need some pain relief. Again, don't take any pain medication unless you consult with your doctor. Okay. So discogenic wry neck treatment approach is a bit more cautious, because by mobilizing too early, you can actually aggravate the symptoms. So we tend to be more careful with discogenic wry neck. The aim of the treatment is to actually deload or to realign the disc, to basically push it back into normal position. Okay, so the special techniques we have in physio that help to do that. Basically increasing the range of motion so you can so we can move it a bit freer. We do a bit of massage to relax the muscles. Again, you need to keep moving, but carefully. If you feel like you do something and it causes a lot of pain, you probably need to back off a little bit. Again, pain medications, if you need it, go and see a doctor to get prescription. For both facet joint and disc problems, strengthening and lengthening the muscles in the neck is very important. Now, Gavin is going to cover this aspect a little bit later. And just finally, how long does it take to get rid of either facet joint or discogenic right neck? Now, for younger people, facet joint right neck, it could take as little as 1 to 2 days. Once you start moving, especially if you go and see a physio and you get those joints mobilized, sometimes it takes 1 to 2 days. Could take up to a week. Sometimes it could take a bit longer, but most of the time it will get better within a week. Okay, as opposed to discogenic right neck, takes a lot longer. Okay, because the disc is involved, it's a bit more serious. So it varies depending on the severity, but it's not uncommon for it to take 6 weeks. Okay, sometimes longer than 6 weeks. Okay, if it doesn't go away within a few days, but yeah, generally speaking, discogenic right neck takes longer to get better. Now I'll let Gavin cover the rehab phase of the treatment.
Hey guys, how you doing? So obviously I've done a little bit of a drawing on the board there just to give you an idea of where the muscles that we need to strengthen are. Okay, and when you got this sort of neck injury, you need to sort of stabilize the whole the whole scapula, which is your shoulder blades and the upper back area. So obviously the pain is caused by weakness in the upper back, I guess, and because we spend a lot of time sitting down, rounded shoulders, they get very, very weak, and we need to obviously strengthen that up to prevent this happening again, and obviously to make the neck stronger anyway. So if you look at my little drawing here, if you can understand, I'm going to demonstrate on Alex in a minute anyway, just give you a bit of an idea. But you got the upper trap muscles there, and they pull the scapula up that way, and you got the lower traps, and they come over the top, and they pull it down that way, and you got the sartorius anterior muscle, which comes underneath there. So if you see people are really, really lean, they got the sort of fish scale muscles there. That's the muscle that we're talking about. So if Alex look at the board for me, I'll just demonstrate on him quickly. So obviously you got a shirt on, but the muscles we're talking about, we're looking at his shoulder blade that comes down underneath there. That muscle will run up the top there into the neck. The other one will come down into the spine, lower back, and then obviously, as I said, this sartorius anterior will come underneath. Excuse me. So there's a couple of ways to do it. Obviously, first of all, you need to sort of strengthen the internal muscles of your neck, like the core muscles of your neck, basically. And the way to do that is if you keep your head straight, you can lie down on the bed and do this as well. Just tuck your chin in and move it out. Tuck it in and move it out. And what that's going to do is going to get those muscles to work inside the neck, just to give you some support. That's one of the first things you're going to do. Then you're going to try and strengthen these muscles by scapular stabilization. So I've got a band set up down here. So what you'll find is that when the upper muscles of the back, if you can keep the arms straight and just move the shoulders back and forth, that's the sort of movement we want to be looking for. But you need to add a little bit of resistance. So I've used these tubing, as I like to use. So you keep your chest up nice and tall, and then just squeeze your shoulder blades together. Hold for a second or two, and then let them relax, come forward. And again, do the same thing. And within no time at all, if you're not used to doing these exercises, you're going to feel the muscles in your upper back start to get a bit tired and start to feel a little bit of a burn, which is a good thing. And then that's going to pretty much sort of do all this sort of thing as well. You work on different angles as well. So if I was to have a set of dumbbells and I was stand up a bit straighter, I could then shrug up in this direction. So I'm going to be hitting more of that upper sort of trap muscle. Then you got the sartorius anterior muscle, this one that comes underneath here, and we do that by a push-up plus is a really good exercise, but a lot of people can't do press-ups. So what we're going to do, we're going to use a little bit of tubing, excuse me, and instead of bringing it back this way now, you're going to set your shoulders back, and then you're just going to push up forward. And then if you do keep doing a couple of those, you're going to feel the muscle just in there starting to tighten and get quite tight as well. So they're the sort of three sort of main exercises that you can do. Okay, so when you're doing this, start off gently. Obviously, it's very much dictated by how much pain you've got, and these are the sort of really basic lower level muscles that you can exercise. And as you get stronger, obviously, you can use different machines in the gym and dumbbells and barbells to really sort of make this nice and strong to avoid all this sort of pain in the future. And like I said, as you get older, we tend to exercise less, and it becomes even more important as you get older to sort of be more active, strengthen those muscles that haven't been used for a long time, so you can basically have a longer sort of better quality of life as you start to age, certainly over 40 anyway. So, like obviously, for Alex and I, we've put together a really good, cool program. I mean, if you want to come and discover your inner youth, we look at your biological age. And a lot of times you're often older than our calendar age, okay? So it's really, really important. If you want to come along and have a free assessment with us, we'll tell you how old you actually are in your body, and then we'll help you get yourself sorted out. And yeah, starting to feel a lot younger again. That's pretty much it from me. Again,
so how do you, in terms of if you'd like to sign up for this Discover Your Inner Youth session, what you can do is just in the comment section below, just put yes, and we'll get back in touch with you through private message, or you can just call us on a 24-hour pre-recorded line. It's 0800 11 0028, or you can we'll put a link in the message in the comment section below. You can just click on that link and sign up online if you like. So again, you will find out. It takes about 40 minutes. We'll do some very simple tests. And basically at the end of it, will tell you your biological age, which can be quite interesting sometimes.
Yeah, exactly right.
So yeah,
Well,
that's
good,
it for now. Thank you for listening.
Cheers, guys.